getting you equipped for every round of life, from the family unit down to the education unit, and now on the third segment, which is the health segment, which is the most important segment actually, because healthy living, it's all we do here in life on earth. And today, like we told you previously, we have in the studio a very distinguished guest in the person of Dr. Shirley Chukwura. You're welcome to the studio.
Yeah, thank you very much.
Thank you. And like we told you, she's a consultant physician. She's going to do justice to the questions often asked about kidney health. It's a known fact actually all over the world that kidney health is now a global issue. It's not just particular to Nigeria. And that's why, because ranging from infections, diabetes, hypertension, chronic kidney disease, and the autoimmune disease known as lupus nephritis. She's going to do justice to giving us clarity on all these issues and help us detect it early in order to maintain a healthy kidney. Over to you, Dr. Chukwura.
Okay, thank you very much. Udala FM, and then good morning, viewers. You're all welcome to today's presentation.
Thank you.
Yeah. So it's still World Kidney Day celebration in continuity.
Yeah.
It was actually marked on 12th March in FM Onitsha, and then we continued the community awareness with this radio program today, still talking about World Kidney Day. And then the theme actually for this 2026 World Kidney Day is kidney health for all, caring for the kidney, and then environmental effects on the kidney. So as you said, I should
all right, I would like you to, some of our listeners might not catch up with the present knowledge about what lupus nephritis is all about. Can you help them understand what this disease is actually?
Okay, lupus nephritis is an autoimmune, it's just one of the complications of an autoimmune disease called systemic lupus erythematosus. So when it affects the kidney, it's called lupus nephritis.
Okay.
It's an autoimmune disease because it is it's hereditary. It's not 100% hereditary. It's not like all the children will have it.
Okay.
Yeah, but when the genes cross on to some individuals, they eventually will develop lupus erythematosus. Commonly, it will manifest with people with joint pains, worse in the morning, better as the day goes by. They may have rashes on their skin, particularly on the face, that is called malarash. They may also have what we call alopecia, which is loss of hairs on the head. Now, these are common symptoms of patients with SLE. I'll be calling it SLE in short.
How do you mean?
SLE representing systemic lupus erythematosus.
Okay.
So these symptoms I have just highlighted are the common symptoms such patients present with. Now, unfortunately, not anybody's fault. Some people don't present with these symptoms. Okay. Because what we're talking about is early detection, and symptoms will usually help you with early detection. Some people don't present with these basic symptoms and they just go straight to developing lupus nephritis. They may still have signs of lupus nephritis which manifest as swollen legs.
Okay.
But they could just think maybe sitting down in one place for a long time, and once people have that swollen legs, they should actually take themselves to hospital and find out what could be the cause before they relax at home.
Sorry, doctor. Let's be on the same page so that we can have clarity to this.
Right.
At what age can people experience such symptoms as you're mentioning, and at what stage too can it become alarming for them to visit the hospital?
Okay, symptoms can actually occur at any time, no matter the age. But we can say it is commoner in the 3rd to 5th decade of life.
Okay.
3rd to 5th decade of life.
That's from the 30s to the 50s.
Yes, so from 21 to the 40 somethings.
Okay.
So that is when it is actually commoner. But it can affect any age. It can actually start in childhood, and it can actually develop much later in life. So it affects all ages. It affects all sexes too, all genders.
Because why I asked this, a friend of mine lost her younger sister, and according to her, lupus nephritis broke out in that sister's life as early as 6 years old. Okay?
Yeah.
So at that age, how would the family, how would the parents know about it? Because you just made mention of the fact that some persons do not exhibit those symptoms before it actually comes on them.
Yeah, so at that age, I'm sure a 6-year-old child would have been presenting with things like malaria, maybe not feeding well, maybe not looking as healthy as her siblings. Because I've told you, symptoms may really be far.
Okay.
But commoner, if you're thinking of lupus nephritis, will be swollen legs. So the legs will be swollen, the face can also get swollen. That patient will have loss of blood and will look pale. So if you look at the eyes, the person is going to look pale. Then when you now ask carefully, you may find other features of lupus, like the joint swellings and joint pains, like skin discolorations.
Okay.
So they may also be present. But typical kidney symptoms will be the swollen legs, the swollen face. The patient may not be passing enough urine, little urine, and in sometimes they actually have what we call polyuria nocturia, which is passing lots of urine, especially at night. So these are some of the things that one will see and begin to suspect this may be lupus nephritis. Of course, to take it to the next level is to go for investigations. So go for investigations, basic investigations like urinalysis.
Okay.
It doesn't waste time. The results can come out immediately.
Like how long?
Immediately. It's just like I'm doing a pregnancy test with strip.
Okay.
So with the strip, you dip it in the urine, and then you read the results.
Can someone do it at home?
If you can buy the urine kit, the strip kits, yes, you can.
Okay.
There's Combi 9, there's Combi 12. So that's the name. But when I say Combi 9, it assesses 9 parameters in the urine.
Okay.
And then there are different ones that. But basic thing you're looking for in patients with kidney disease, lupus nephritis, is the protein in the urine.
Okay.
So when you do a urinalysis, you're going to find protein. It will be up to 3 pluses.
What is the normal protein appearance in the urine?
There should actually be no protein in the urine.
Good. Okay.
Yeah. So when you see protein, 3 pluses in the urine, now there are other things that can cause protein in the urine, like a urinary tract infection, but you won't expect it to be up to 3 pluses.
Okay.
You'll probably see just 1 plus or 2 pluses. And when you have 3 pluses, it becomes worrisome. At that stage, you should actually go to the hospital, where they will do further tests. Now, by now taking blood to do the kidney function test. So kidney function test, they are basically looking for the urea, the creatinine, and the electrolytes.
Okay.
And then they can now calculate what we call the glomerular filtration rate, which is now able to stage the person's kidney disease. Is it stage 1, stage 2, stage 3, stage 4?
Okay.
So stage 4 is the advanced stage. That's
when you talk of kidney disease, can you actually break it down to a layman's understanding?
Kidney disease, layman understanding is so the kidneys are those organs in the body.
Okay.
There are two of them. They are located in the lower part of the abdomen, and they are more posterior. They are more located behind than in front. So everybody has two kidneys, even though we need just one to keep us for life. But God has blessed us with two.
Okay.
So we all have two. The function of the kidney essentially is to make urine. A lot of blood passes through the kidney. In fact, the kidney is said to about 50 gallons of blood passes through the kidney in 24 hours.
Wow.
So it's a very busy organ, filtering things and excreting the bad things. So you don't want the kidney to fail, because if it fails, it won't be able to excrete bad things.
Okay.
And those are those toxins that destroy the body. So when the kidneys are not able to perform the functions, primarily excretion, it also helps in making of blood. It also helps in production of some vitamins, especially vitamin D.
Okay.
So when the kidney is not able to do this, then the person has accumulated toxic products, and that can result in what we have highlighted.
If one detects any anomaly with the kidney early, would it prevent the kidney disease?
Yes, of course. If it is detected early, the measures are put in place immediately to ensure it does not progress.
Okay.
Yeah. So those measures will include identifying the risk factors and treating the risk factor. If you identify the risk factor and stop it on time, then the person is most likely not going to continue progress with the illness. Like you talked about lupus nephritis.
Yeah.
This one, in this case now, you need to, not only the nephrologist that will be managing, there will be a place for the rheumatologist, who is the specialist for connective tissue diseases like SLE.
Yeah.
So those two will really be involved. So they're going to give some drugs, because what actually happens in autoimmune disease is that the body is fighting itself. So my body is not able to recognize the cells of my body any longer, and it begins to fight it. So the rheumatologist will be there to administer medications that will prevent the body from fighting itself.
Okay.
And when that happens, then the kidney damage is reduced.
Okay, in as much as we are talking about lupus, okay, I would want you to, tell us causes of kidney disease, types of kidney disease, and what people should also do to, avoid all this kidney disease.
All right, so starting with the causes of kidney disease, there are common causes like hypertension, which is increased blood pressure more than 140/90 millimeters of mercury. Then diabetes, which is sugar disease, when the blood sugar is high. A lot of people check with glucometer and other measures. So these are the two commonest. But then there are other common things in our environment that cause kidney disease, and that includes alcohol. So people that take lots of alcohol, and then herbal medications. Our people like taking herbal drugs. See all those green things they carry on their heads. All those things are not good for the body, and especially for the kidneys. Then we've talked about autoimmune disease today, like lupus nephritis. Then the environment also has its own causes, like when people, like I have said earlier, a lot of blood passes through the kidneys, and so when people burn certain things and people inhale carbon and all those, even water, presence of heavy metal in water can cause kidney diseases.
Heavy metal like
so things like lead.
Okay.
And then some of those things too are present in insecticides. So I guess the environmental specialists will be able to talk more on those ones.
Okay. So what do people now do to avoid kidney diseases?
So to avoid kidney diseases, do things like exercise. Like I think on Thursday during the World Kidney Day at FMC, there was a walk. So usually that's part of the things people do to celebrate World Kidney Day. You take a walk. At least 30 minutes of exercise daily can help. Take lots of water.
Okay.
At least 3 liters of water per day. In fact, currently the weather is so hot that dehydration on its own is also a cause of kidney disease. So people are encouraged to take lots of water. So all those people that look for things to flush their system, all those herbal things to flush their system.
Exactly.
The best thing to use to flush is actually water.
You know, in Nigeria, many people rely on herbal mixtures. Once they feel unwell, they just bundle it into their mouth and swallow it like that. So does it affect the kidney?
Yes, it does. Not only the kidney, it affects other systems.
Wow.
Yeah. So back to the measures people should take. They should check their BP regularly, check their blood sugar regularly, avoid overweight, avoid alcohol. These are, then coming to food, reduce salt, low salt diet. So we're not really able to measure what 1 gram and 2 gram is at home, but we can say that in a day one shouldn't take more than 1 teaspoonful of salt. So check from morning till night. If you've consumed more than 1 teaspoon.
How do you measure that?
You can check.
Honestly, how do you measure it with all the fast food and all the
You get
So that is
the
another
snack
problem.
and all of them.
Yeah.
That's a problem. That's another problem with the fast food, because you cannot say what really is there.
exactly.
Yeah, so you're encouraged to eat at home. I'm sorry.
You know it's not possible.
try and make your own food if you can. Then a family history of kidney disease. If your parents have had kidney disease or a sibling has had kidney disease, others should take note and be careful. Regular checkup, at least once a year, and to check the kidney function, check their urine, so that if anything is detected, it should be on time.
It's actually a good thing that kidney disease can be detected through urinalysis.
Yes.
Yeah,
yes.
because I think most people do not know that. They think it's a very cumbersome test
No,
to
it's not
carry out
cumbersome.
before you find out the state of your kidney.
It's not just urinate in a small
Exactly.
bottle and submit. They put in a stick inside, and then they're able to tell you the parameters. Glucose can be seen, protein can be seen, red blood cells can be seen. So these are some of the things that can be seen when one does an analysis.
All right. We're going to open up the phone lines now and let people ask questions.
All right.
And please remember, dear listener, once you come on air, you have 2 minutes to ask a question and step down for another person to come in. Okay? And do not waste time. Okay? All right. The numbers to call. You can watch us live on Facebook, actually. Udala Radio 104.7 FM. Okay? On Facebook, or you go to our YouTube and press Udala Radio. On Instagram at Udala Radio. All right. The numbers to call are 0803 221 6973. I take it again. 0803 221 6973. Or 0803 827 6694. 0803 827 6694. Let's have your opinion on this.
Okay.
Please, I would like to tell us once you come on air, do well to lower the volume of your radio set, or better still, step away from it so that we can hear you. Hello? Okay, while we're waiting for the callers to call, because this program has not been an interactive one for a long time, so I guess that's why. Okay. You can help us by telling the listeners what to look out for, or how to, what to prevent, so that what you recommend for them to do either quarterly or 6 months, or how to keep the kidney fit.
Okay. Still the same preventive measures.
Okay.
So measuring people should have their blood pressure measured at least monthly, especially when you're 40 years and above. In fact, once one is 40 years and above, the person should actually
Let's
take
take
note
this
of
call.
it.
Hello, good morning. Step aside from your radio set.
I guess we have a lot of teaching to do this morning. Please, when you get us on phone, please step away from your radio set so that we can hear you. All right, and the numbers to call still 0803 221 6973.
Good morning. Are you there?
Hello, good morning.
Okay, so while we are waiting for the call, what about diagnosis and treatment of kidney diseases?
So once the diagnosis is made, the next thing is to stage the kidney disease, like I said. So for stage 4 and stage 5, they are called end-stage renal disease. So for those, that's where you talk about dialysis and kidney transplants. So at that stage, dialysis is offered by a lot of people around. FMC Onitsha also has dialysis services available there. The government recently also made the payments free for patients going for dialysis.
Where?
It's in most of the federal institutions.
Okay.
So most of these federal institutions have free dialysis.
Oh, that's beautiful.
Yeah,
Let's
so
take this call.
Hello, good morning.
Please step away from your radio set.
network is bad.
Yeah,
Okay.
the network, I guess.
All right, let's go for commercial break, and when we return, we will continue.
Exactly.
Do not go anywhere. We'll be right back.
You're listening to Udala Radio 104.7 FM. Seriously authentic.
Nolin Ventures. Nolin no compromise. If na quality you dey find, no waka pass o. Nolin Ventures Limited na correct plug for better living. From electronics to home appliances, furniture, plastics, gadgets, and even kitchen wahala. Everything wey your house need, Nolin Ventures Limited get am. Nolin Ventures Limited dey for number 16 Enugu Road by CPS Onitsha. You fit get products for better price wey go give you peace of mind. Na fridge you need, na washing machine, TV, abi na sofa. No stress o. Make you call Nolin Ventures Limited for 0803 321 7222. Na 0803 321 7222. Nolin Ventures Limited. Quality no be luck, na choice o. Nolin Ventures. What have you without Christ?
Bible-based Miracle Assembly, Freedom City, Anambra State, presents special service of song in honor of late Reverend Dr. Umar Okpai. Join us as we honor our father, late Reverend Dr. Umar Okpai, an icon, God's Kingdom General, Apostle of Miracle, a philanthropist whose life on earth made incredible impacts among nations of the earth. Ministering Bishop Moses Ezedebego, PFN Chairman, and many more anointed men of God. Music ministers Arinze Lawrence Arihi, Choma Egwoyoko, Mabel Arihi, Chukudubem Okono. Host Reverend Dr. Jerry Machuku, Power Jam Power. Date Monday 16th March 2026. Time 1 p.m. Venue number 19 Ezendo Street off Mercedes Avenue, Mpo. For inquiries, please call 080-3644-3446. Be there.
This is the week for Healing Stream with the man of God, Pastor Chris. Healing Streams is this Friday, Saturday, and Sunday. Time is 2 p.m. daily. Now this program will be streamed live to every home, every laptop, every phone. You can connect with your own phone to the healing power of God, or come to Christ Embassy 66 Limca Road, Old Road, and attend the Healing Streams live healing services with the man of God, Pastor Chris. And of course, all our Christ Embassy churches everywhere in Anambra State and beyond will be healing centers. So you can call us on our phone number for more details, 070-3300-4456, and you will receive full details. Make sure you come, don't miss it. 3 days, your healing is now. Praise God.
Onitsha, the business people. Now our own way be this to say thank you for one solid year of community broadcasting. Udala Radio don't clock 1 year this March. And now we dey celebrate all the hardworking businesses where they keep this city moving. For the whole month of March, see a special anniversary awoof. Buy 2, get 1 free. You hear them well. Advert, airtime or program slot. When you buy 2, we go dash you 1 extra free. More airtime, more visibility, more customers, and you no go pay extra kobo. Whether na shop you get, school, clinic, restaurant, or any brand where they grow. Now your chance be this to make all of Onitsha hear about that's your business. But make you move sharp. This offer will last only till 31st March 2026. Our anniversary month, terms and conditions apply. For booking and inquiry, I beg make you call our marketing desk now for 0803-350-4206. Or you fit come our office for the heart of Onitsha for number 5 Okono Street, DMGS Roundabout, Onitsha. You fit call for 0803-350-4206, or you fit visit for number 5 Okono Street, DMGS Roundabout, Onitsha. No forget the number, no forget the address. Udala Radio, seriously authentic, proudly 1 year with you.
From the commercial city of Onitsha comes Udala Radio 104.7 FM, the voice of the region, where authentic news and entertainment meet. Udala Radio 104.7 FM, seriously authentic.
If you can move the highest mountains, cross the greatest oceans, and walk across the water, the world.
Alright, welcome back. It's still Udala Radio 104.7 FM Onitsha, your seriously authentic radio station. And we're still on the health segment of the magazine show, Udala Family Time. If you're joining us, we're discussing all about kidney health in continuity of the commemoration of the World Kidney Day, which was held on Thursday, the second Thursday of March, as they do it every year. And right here in the studio, we are with Dr. Shirley Chukura, a consultant physician. So this is the interactive session. You can join us and ask any question you need to know about kidney health. We discussed about the things to watch out for, the prevention, the care, and the symptoms to watch out for, the diagnosis and the treatment. So you can call and ask any question of your choice. The numbers to call still remain 0803 221 6973. And you can join us live on our Facebook page. Just press Udala Radio 104.7 on Facebook, and on YouTube Udala Radio. Okay, on X and Instagram at Udala Radio. You can watch us live and ask your questions too. Okay, so call us on 0803 221 6973 or 0803 827 6694.
Okay, doctor, while we wait for the calls, I've heard something like acute kidney injury and
chronic and chronic.
Yes, chronic yes.
Kidney disease.
Kidney disease. What are the difference?
So the difference is the duration.
Okay.
So acute kidney injury is less than 3 months, and once the disease has lasted more than 3 months, then it's chronic kidney disease. Now, the causes of acute kidney injury are not essentially what we have been mentioning. Acute kidney injury will usually result from when there is something that really troubles a big shock to the kidney. So that can happen with somebody that has lost a lot of body fluids. Maybe someone that had diarrhea that lost a lot of body fluids.
Oh.
So not enough blood to the kidneys. The kidneys can quickly shut down.
Wow.
Someone that had an accident and lost a lot of blood. Then infective processes like sepsis. So if somebody has sepsis, a bacterial infection of the blood, it can also cause an acute insult on the kidney, and that gives rise to acute kidney injury. Now, if you do not replace those fluids on time, or give the appropriate antibiotics on time, or stop what that insult is at that moment, then the person will most likely progress to chronic kidney disease. Wow. So that's the difference between the two.
So you're saying that within the duration of 3 months at most, the person with persons that have encountered this kind of incidents you mentioned should, refill the fluid lost.
The person should be in the hospital.
Okay.
So we usually use intravenous fluids. That's what we call drips.
So it's not something that can happen anyhow.
No.
Yeah.
Let's take this call.
Hello, good morning.
Are
Hello.
You there? Good morning.
Hello.
Okay.
Hello, good morning. Welcome to Udala.
Hello.
Hello, good morning.
We can hear you.
Hello.
Good morning.
Hello, good morning. Can you tell us your name and where you're calling from?
Can you hear us?
I don't hear you talk very loud.
I guess it's the network. We're hearing you clearly, but you can't hear us. Okay. All right, the numbers to call still remain 0803 221 6973 or 0803 827 6694. Call us and ask your questions. We have the doctor here to attend to you. Ada, you were saying something. Okay, we have a call.
Yes. Hello.
Hello?
Good
Hello,
morning.
Good morning.
Yeah. Can you hear me?
Yeah,
Yes,
we
can hear you.
Okay. Hello. I want to ask that question.
Please, can we know your name and where you're calling from, please?
So, what of can kidney problem be cured?
Please, can you be more audible so that we can hear you?
Yes, I say, can kidney problem be cured? Definitely.
Can
What
kidney
about-
problem be cured?
Can
Doctor, you heard him.
Yes, I heard him.
you hear me?
Yeah,
Yes.
we can hear you.
Okay, can it be cured? Definitely. Then another thing, what are the things that someone will be taking for life that can make it to come back again?
Okay.
Okay.
So I find myself I'm having the problem of the kidney problem.
Okay.
And it was once treated.
Okay.
And I found out that it used to come back again. I'm having some pain, heavy pain in the joint, some rashes in my body.
Wow. All right.
Wearing bed, drinking in the night, constantly. This one started like 3 days ago now. So I'm taking some medication. But how can it be prevented? How can it be cured forever? Is there any hope or guidelines on what somebody will do in order to stop having it and come back to this or have it? So this is my question. Doctor.
All right. Thank you so much. She will attend to you.
Okay, thank you so much for your question. So it will depend on the cure will depend on what caused it. So you see, you're a man, and I don't know how old you are. So there are obstructive things like for men when they have enlarged prostate. So it can press on the ureters and cause a backflow to the kidney, and that can cause over time chronic kidney disease. Now, if the prostate or whatever the obstruction is removed, then and the damage to the kidney is not advanced, stage 4, stage 5, then such a person can actually be said to have, there is really nothing that is going to cause or tip it again into that based on the prostate has been removed.
Okay.
So it will depend on what caused it. If it was high blood pressure that caused it, and the patient has been staged, most important thing is that it is not stage 4 or stage 5, because it is at that stage that you begin to go for dialysis. And then the eventual cure in quotes will be getting a new kidney. But then when you get the new kidney, you don't want what caused the problem in the former kidney to happen again.
Exactly.
So if it was BP, sugar, then it should be controlled so that it does not happen again. So dear caller, you need to go to hospital, find out what caused your kidney problem. Has that thing been arrested? Because for you to say it got better means at the time they did a urinalysis, they did a kidney function, and it was fine. What caused it initially? Has it been taken care of?
Exactly.
So that is what you need to find out. Now,
so basically what you're saying is that once it's at the early stage and the cause of it is taken care of, it will not resurface.
Yes, it will unlikely progress.
Okay.
But like he asked, are there things to avoid so that it doesn't come back? So it is still those same things. People have this habit, they go to their friends, see my problem. It has come back, but then their friend is still pushing them to go and take this herbal mixture that he or she wants to. And then you now go and take it. That's adding insult to something that is already trying to get better. So just avoid all the risk factors we mentioned earlier. Don't do them. Reduce salt, control BP, control your weight, control sugar.
And what of someone that is diabetic?
So that's basically it, is to control sugar.
Okay.
Make sure the sugar levels are within normal range.
All right. And what of when it affects a child? How would that child, go about it?
The pediatricians, that a physician is a doctor for adult medicine.
Yeah.
So the pediatricians take care of children.
Hello, let's take this call.
Hello, good morning.
Good morning to you. You're welcome.
Okay.
Can you tell us your name?
Hello?
Hello, we can hear you.
Okay.
Can you tell us your name and where you're calling from?
Okay, my name is Miss Chiamaka,
calling from Southern Rapper Specialist Hospital.
Okay,
All right, you're
welcome.
welcome.
Thank you.
Go ahead. Chiamaka, are you still there? Yeah, we can hear you. Go ahead.
Okay, can I have a few questions to ask?
Okay.
Hello?
Chiamaka, go ahead. We are listening.
Okay, so my question is, what are the symptoms that we should watch closely for concerning these kidney diseases? So what are the early symptoms that we should watch closely for? Then another question is, what are the drugs that should be stopped for avoided? Because some people don't really know about don't really know that some drugs causes acute kidney infection.
Okay. Thank you so much for your question.
Yeah,
This is
Chiamaka.
my question.
Chiamaka,
Yeah.
we
Yes,
got
we
your
do.
questions correctly.
Okay.
So, Chiamaka, thank you very much for this question. So let me start with the second question, because truly I totally omitted that.
Yeah.
So the drugs to avoid, or drugs that can predispose people to have kidney disease, the commonest is most of these painkillers.
Okay.
These ones we call NSAIDs.
Yeah.
Atrotec, ibuprofen, diclofenac, and all these people that go to mix drug in chemist shops for malaria and typhoid, they always put in these drugs for them. So NSAIDs are the drugs that commonly would affect the kidneys.
What did you call that again?
So NSAIDs mean
Okay.
non-steroidal anti-inflammatory drugs.
Okay.
They are painkillers,
Yeah.
and they are not good for the kidneys.
Okay.
Yeah. Now to the second question.
But in hospitals, they do administer that too.
So there's something called if the benefit outweighs the risk.
Okay.
So if it is very important at the time to use it, but if the person, if you already know that this person has kidney disease, you don't use it. There are other painkillers you can use.
Okay.
But
Like
the opioids, like the paracetamol.
okay.
Yeah, you can use the paracetamol and the ones we call opioids.
Okay.
The tramadol, cocodamol. Those ones are better for the kidneys. The NSAIDs cause little blood to get to the kidneys. It causes vasoconstriction. The vessels are constricted. So little blood gets to the kidneys, and over time, the kidneys are injured.
Affected.
Yeah. Now, her second question was about the symptoms, which
Yeah.
we have been mentioning before. Now, I'll not answer her question directly. I'll answer her question as complications of kidney disease.
Okay.
So, we've talked about the swollen legs, the swollen face. We've talked about persistent vomiting, persistent hiccups. The patient can at a time start becoming unconscious, and that's called encephalopathy. So patient is not able to know where he or she is. Then person can have what we call pericarditis, fluid in the chest, and then also has chest pain.
Okay.
The person can have uremic gastritis with burning sensation in the upper abdomen, and may even vomit blood or stool blood. The person can also manifest with dry skin, and that's what we call uremic dermatitis. So the patient can present with dry skin, itchy skin, or what we have uremic frost. They will be like white stains on the skin that
Breaking out on the
falling
skin.
off from the skin.
Yeah.
So these are some of the other presentations patients with kidney disease
Can
can.
have.
Yes.
So, but I know she made mention particularly of the early symptoms, so that once the person sees that, he or she can proceed to the hospital for
Yes.
diagnosis.
And that's why I actually went back. The early symptoms remain.
Is a swelling of the leg.
Yeah. Passage of frothy urine. So frothy urine is foamy urine.
Okay.
So a person goes to urinate and notices that the urine is foaming. What
Foaming.
is actually causing the foaming is the protein in that urine. That's what is causing that.
I hope that's not the same with when someone is dehydrated and if you pass urine it will be foaming.
No, if you're dehydrated and pass urine, it will be dark color.
Okay.
It will be dark yellow. It won't be
Foaming.
No, it's not foaming. Foamy urine is kidney disease, and is the protein that is responsible.
All right, let's take this call. Hello. Step away from your radio set.
Sorry, I'm in my car.
All right, thank you,
Hello.
Hello.
Hello?
Hello, we can hear you.
Now,
Please tell us your name and where you're calling from.
I've just joined.
Okay.
Hello?
Hello, we can hear you. Welcome.
I've just joined. I want to know exactly the food that causes the damage in the kidney. Those foods are boiled. I've just joined. I've just joined my food.
Please, can you move to the side of the road so that we can hear you? It's really noisy.
Okay, let me park.
All right, but you asked a question.
I got
just
your
listen.
question.
Yeah, we got your question.
And the foods to avoid.
No problem.
Okay.
No problem.
What are the foods or drinks you should avoid?
Okay, she will give you the answers now. All right.
All right. So the foods to avoid, for the sake of the kidney, I mentioned you should be on a low salt diet. Do not put a lot of salt in your food. Now, proteins too. Excessive protein intake. Just eat that normal protein. That normal protein that when you cook or when your wife cooks, she puts 1 or 2 pieces of meat. Don't go to eat the whole chicken or the whole goat. So yeah.
So those that are eating a lot of meat,
yes, a lot of
chewing a lot of meat, you know.
Yeah, that's not good for the kidneys.
How about fish?
Fish generally is okay. Fish contains omega-3.
Okay.
So fish contains omega-3. We're also not going to, there's really nothing that you're going to eat and eat excess.
Yeah.
Just eat in moderation.
Yeah.
Then avoid alcohol. Avoid herbal drugs. Then for the sake of the diabetes, you should also not take a lot of sugary things, especially when diabetes is in diabetes runs in the family. So if you have other risk factors for diabetes, then start on time to avoid excessive sugar drinks.
Okay.
Yeah.
Thank you so much.
Carbonated drinks.
Yeah, that's the sugar drinks, the carbonated drinks.
Alright, do well to call us back on 0803-221-6973. 0803-221-6973. Alright, call us back. We're going to take 1 or 2 calls, then we wrap it up on this segment. 0803-221-6973. Do we have someone? Alright, I go ahead to read out the messages we got on the Facebook page. This is coming from Francis Nnamani. Also Francis Omaga Nnamani, watching us live from Amagunze in Enugu State. He says, "Good morning, my people in the studio, and keep up the good work. Thanks so kindly for the health tips and awareness program." Thank you too, Francis.
Let's take this one. Hello, can you step away from your radio set?
Good morning.
Good morning to you. You're welcome.
I'm Izina calling from Onitsha.
You're welcome, Izina. Go on with your question.
Please, thank our guest speaker, the doctor.
Thank you.
Thank you all for your efforts in keeping us in good health.
Thank you.
Now, there's something I just want to ask about.
Okay.
You made mention of foamy urine. That is a sign of kidney problem.
Yes, I do.
Supposing one wants to go for test of it, will you now go for the test for the urine, the kidney problem, or what test do we go for? And someone that is having pain, that takes too much drugs, painkillers, you say that it can cause something like that. How do we avoid it? Even the pain and other things. Thank you.
Thank you
Alright,
so
thank
much,
you.
Ezina.
Yeah, thank you, Mr. Ezina, for calling. So, the first question you talked about passing frothy urine. So, what you do is to go to a good laboratory, and they will ask you for your urine. So, when they ask for your urine, they will check those parameters, including the protein in your urine. So, when they give you your results and you see, well, you shouldn't be able to interpret it. The laboratory people shouldn't interpret it either. Just carry your results and go to your doctor. Your doctor will be able to interpret the urinalysis results. And if there is need to go ahead and do other tests, like the blood test for the kidney function or the ultrasound scan to see the picture of your kidneys, then your doctor will ask you to do that.
Okay.
All right. Now his second question was the drugs for
The
for
painkiller.
the
That you
painkillers.
said something about the
So
painkillers.
so it's the same thing. Please go to your doctor. I've told you there are alternatives. Truly, as we know that arthritis is a disease of the old age, so most people are likely to be on one painkiller or the other for the sake of the arthritis. So there are other options, especially for those that already have kidney disease. And even when we prescribe painkillers, like the ones I have mentioned that are not good, we usually give it for a short time so that it won't have enough time to cause problem for the patients. So please meet your doctor.
All right. Thank you so much, Dr. Chukura. What's your last word to our listener this morning before we wrap it up on the health segment?
Okay, to my listeners this morning, my last words are, please, it is better to prevent kidney disease than to develop kidney disease. Please, let's do what we can. Let's live a healthy lifestyle. Avoid the things we should avoid and check the things we should check regularly. Go for our regular medical checkups. To be forewarned is to be forearmed. Remain blessed, listeners.
Thank you so much,
Thank you
Dr.
so much,
Chukura. And that's where we call it a day on this magazine show this morning. Not before we acknowledge the recommendations and greetings from Comrade Samson Chooks from our Facebook page, and Okoye Angoleka texting us from Umoji, Anambra State. She says, thank God it's Saturday. And you heard it all from the horse's mouth. We'll be here by the grace of God 2 weeks from now, because next Saturday will be our anniversary celebration proper. So we won't be coming out. All right, all roads will lead to Udala FM on that Saturday, because it's our 1 year anniversary. And up next will be the Crossfire with Dr. Tony Olisa Mbeki.
Oh, Gadagidi.
Oh, yes.
One of us.
And we're having in the house this morning a special guest, Chizoram Ofebu, aka Ijele Speaks.
You wouldn't like to miss today's Crossfire.
Exactly, the king of the game. He will be here live to talk on Crossfire with Dr. Olisa Tony Mbeki or Gadagidi. Until then, I remain Chinyere Omiko, wishing you the pleasantness of today's weekend. Stay tuned.
All right, thank you so much for always joining us. You know we love you so much, and do not forget that next week Saturday is our anniversary. Another Saturday we come, we'll still be here. Thank you so much for being our number one top fan. We love you so much. I am Nweke Adolis. Do have a pleasant day.
Thank you.
A city of movement. A city of trade. A city of heritage. From the rays of the sun to the radiant glow of the river Nile. From the echoes of Ose Market to the silent prayers